If you've decided that today's the day that you take action about improving the stiffness and reducing the pain in your hip, well, this is the video for you. Hip osteoarthritis, if left untreated, can start to dictate your life. But I'm here to tell you that there is another way, a way that doesn't cost you a dime, that doesn't require surgery, that doesn't require you to spend the rest of your life eating tablets for pain relief, and is recommended by many guidelines as the first choice treatment strategy throughout the world. That treatment strategy is exercise therapy, and more specifically, strength and mobility training. Now, please don't get disheartened. That doesn't mean having to join the local gym or get out your joggers. Okay? It can be done from your living room and can take as little as 10 minutes per day. Now, what can strengthening your muscles do to help you? Well, it can help you get out of that low chair you've really been struggling with. It can help you get in and out of the car. It can help you walk further distances. It can help relieve some of those pain symptoms that you're currently feeling. And not to mention, it does have many benefits to your health and also your mental health. In my last video, I showed you my favorite beginner exercises for hip osteoarthritis. And in this video, I want to show you some intermediate exercises. Now, feel free to use some of the beginner exercises in conjunction with these intermediate exercises, as some exercises may be easier than others, and that's probably due to some muscles being weaker than others. It's your choice. Now, don't forget that these exercises are general in nature and do not substitute for a professional opinion from a doctor or a physiotherapist. And these exercises just might not be right for you. If they cause extra pain or increase your symptoms at all, I recommend stopping them straight away and seeking advice from the appropriate healthcare professional. All right. Now to the exercises. So the first intermediate exercise for hip osteoarthritis that will help you take control of your life again is the sideline hip abduction. Okay, so in the beginner exercises, we did a standing hip abduction. Okay, but this time we're going to go against gravity. So we've got the weight of your leg. Okay, so if we go into sideline, and just like we did in the beginner exercise, we want to try and come up, and then we want to hold for about 2 to 3 seconds and come down, up again, 2 to 3 seconds. And as with any exercise, we want to try and work up to about 20 reps in total by the end of, say, a few weeks. Okay. If that's a bit too hard for you at this stage, what you can do is bend your legs like this. Now it's called a clamshell. So you think this is the mouth of a clam, and we're going to open up like this. So that's probably a step back from the straight leg. And this will help you to kind of get in and out of the car, because you need this muscle here to be able to step out and over. Okay. So the next exercise that we can do is for your big hip flexor. So in the last video, we had you just bringing your knee up in standing. Now to make it a lot harder, we're going to have the whole gravity of your leg, or gravity pushing down against your leg, which is the whole weight of your leg. Now, if you're finding it quite easy, I think it's best to begin with, I think it's best to bend your knee, have it like this, okay? And if this is, I guess if you found bringing your knee up quite easy, then what we can do is actually keep our legs straight and come up like this. And a little tips to make things harder is never let it rest. So if you come up, slowly come down, never let it rest. It's going to be a lot harder. Now, if this just really aggravates and hurts you, what you can do is bend, okay? So you're going to come up like that, okay? So start to bend your knee, okay? And that one is going to help again for you to step up and get over, alright? And it's also going to help you with your walking and even getting out of a low chair. Okay, so what we have next, and I think is just critical in knee and hip osteoarthritis, is the bridge. Now again, what we want to do is we want to lie just like this. We're going to push through our heels and bring our bottom up slowly on the way down. Again, if you have some lower back issues, and what I recommend normally is I want you to try and push that lower back into the lounge or mattress or ground, wherever you're doing it, and then we want to push through and come up. Now, my fourth favorite exercise in the intermediate exercise program is the box squat. Now, this is a very low lounge, so I really don't think that that would work well. However, if you had something a bit higher, say maybe this high, it'd work quite well, even just using the side of the lounge. So what I want you to do, okay, is just a normal stand up, and then I want you to come down, and instead of sitting down, I want you to just tap your bottom. Okay, now this is a lot harder than just a normal sit to stand, because you've got a lot more time under tension. So those muscles are constantly working whilst you are doing the movement. Now this is amazing for glute strength as well as control, and hopefully over time you'll be able to get down to that low chair and pop up, no worries. So again, this one's a lot harder, so I probably would say it would take you a while to get to 20 in a row. So if you can just start aiming for about 12, that's fantastic. And if you get to 20 over the next few months, you're doing really well. Now, the fifth and final exercise that you should be doing for your hip osteoarthritis is the step up. Now, it can be as easy as just getting a couple of books, maybe some phone books or old street directories or something like that. And what you want to do is have something stable next to you. I always recommend the kitchen bench, as that is way more stable than a chair like this. And what we want to do, okay, is we want to have one foot back, or the resting foot down here back, the osteoarthritic leg up on the book, okay? And what we want to do is, instead of just stepping straight up like this, which probably works more the quads, what we want to do is we want to slowly lean a little bit forward and then come back down. And you'll feel that a lot of that weight actually transfers to the glute muscle. Okay, so and just to show you a better angle of what I'm talking about, and again, you want the chair or the bench on the side. And in this situation, what we're going to do, we're going to lean a little bit forward like this, step up, and again, this one might be a bit of a challenge to begin with, so probably aiming towards the 12 rep range, but over the next couple of months, I think you'd be able to build up to about 20. And make sure you do both legs for every exercise, okay? Do both legs. And this should take you 10, 15 minutes at most, okay? And will help you to get well on your way to a functional hip and a life again. So I hope you really enjoyed this video, and I hope it brought some benefits to you and your family. In the future, I do plan to create a program which will put all these exercises into, I guess, a program so you know which exercise to do which day, and they'll have videos explaining how to do each exercise, and will tell you the amount of reps that you need to do. So thanks for watching. Let me know in the comments if that program is something that you'd like, and please let me know if there's any other topics that you want me to cover, and please like and subscribe. Thank you.